check if I have a blood pressure cuff with me. I have a thermometer. I have a stethoscope. I have a pen light. Why do you think I need a pen light?
My ears, my
Eyes.
Smells good. Do you know something called perla? Have you heard about it?
pupil or something.
Yeah, pupils. Right? Pupils equal reacting to light. So I gather all my equipment, right? And then I'm going into the patient's room. When I walk into the patient room, I always knock the door, right? Knock, knock. Can I come in? And then can you draw the curtains for me? Provide privacy. I'll pretend now there's privacy because I want you to see, right? And then I'm going to look at the patient and say, hey, Francis, my name is Anita. How are you?
No.
I'm going to be a nurse today. Can I do a head-to-toe assessment on you?
Okay.
All right, so you have to get consent, right? Because you do not touch a patient if they do not let you to do, right? And then I'm washing my hands and I'm going to wear gloves right away, right? I brought my equipment and I'm placing it on the table right here. I'm going to put the height of the bed to a comfortable position. Assuming he's safe now, I'm going to lift the bed higher because I don't want to, bend too much on it, right? And it's easier for my back. Don't want to hurt my back. All right, so put it up, wearing my gloves as I do this. First thing I have to do is check his ID to make sure I have the right patient, right? Hey Francis, can you please tell me your name and date of birth?
Francis 2111.
So I'm looking at the ID and date of birth and matching to see if I have the right patient. That's all part of safety, right? Yeah, this is the basic safety thing which we do always do it first, right? And then I can ask him, do you have any pain today? Do you have any pain today? Just say no for everything,
no.
yeah. So yes, no pain today. And then I'm going to see if he's alert and oriented and if he's, cognitively intact, right? So he already told his name, it was matching, right? Do you know where you are today?
No.
Okay, today you're at the CVS, right? Okay, whatever place you are, he's telling the right, we'll assume, no, tell everything normally, okay? So he's telling, you ask him where he is, right? Name, person, place. And then you can ask the date, you can ask him more if you want, like what is the president? Do you know the month and the day, your year? So you're checking his neuro status, right? And when you document, you say alert and oriented times 3, name, place, person, time. Okay, got that part? And then you could go ahead and do the vitals right now. So I'm going to do his blood pressure. I'm going to check. I want you to do this. I assume everybody knows this. You already passed your CNA course, He's checking his blood pressure now, and I'm seeing his blood pressure is 120 over 80. I'm checking his pulse ox. Can you put your finger in? So I just show how.
So when we do it over here for the actual exam or whatever, it would have to be the manual, not the Dynamap or whatever.
We have a Dynamap, it works. If you want to use it, that's fine.
Okay.
It's your choice.
Okay.
I don't mind. So I'm going to check the pulse ox. What is the pulse ox for?
Oxygen.
Go to STEM, right? It is about 92%. So I see how I'm verbalizing. I'm telling what I'm doing, and I'm also saying what is normal, right? Assuming this is a normal patient. And then I'm going to listen to his lungs. I could do this later. And I'm going to look at his eye later. I'm going to check his his temperature. What would be normal? Okay, good. So you say if it's 60 to 100, whatever range it is, you can pick a number and say he's 80. Sorry, after the temperature, you say the heart rate too. Okay, so you've done all the vitals, right? Then you do a head to toe. You check if he's alert and oriented. Then you've done this part. You can mix the order a little bit, okay? But not a lot. So I'm going to look at his head. Can you take the cap off? Sorry. So you're just looking at the head to see it. Any hair loss, any change in color, lesions, because that's part of your head general exam. And then you could also see for any changes. I don't see anything, right? Then you look at the skin. Can you stretch your legs for me, please? And open your arms a little bit. I mean, we pretend that this person is having a gown on so you can easily see the skin. Can you open your... Yeah, good. So I'm looking at the skin. When you look at the skin, what do you look for? Symmetry. In general, if there's any change in color, right? Any masses, lesions, right? In general, I don't see any hair loss. Skin tells you a lot of stories, right, about your body, right? Any swelling, I don't see any hair loss, no muscle wasting. Nails, look at the nails. It looks good, the nails are intact. I don't see any chips or, or any color changes as well. Even in the legs, you can look at the skin. Okay, we'll assume he's got his whole thing open up here, right? And then you do the perla. Perla is looking at the eyes. The eyes tells you a story about what? Your eyes, and then pupil, and then
nose.
Nose, cranial nerves, right? So kind of your neuro. When do you think a person might have unequal pupils. One is small, one is large.
Stroke.
Possible. Any type of brain, many type of brain conditions, trauma, right? Injuries to the head, or damage to the eye itself, right? Or cranial nerve problems that will not help. Or the muscle damage too, right? That helps you to dilate. When do you think your pupils will be dilated? In darkness or when there's enough light? When do your pupils dilate? Darkness. Why? Your camera lens. Want to capture more, right? Right? Your lens. You have lens in your eyes, right? It wants to go. So what happens to the pupil? It dilates, so it can capture more, right? And what are the situations can make your pupil dilate or constrict? Drugs. How about flight or fright? You're running.
Yeah.
You want to be dilated, right? And in times of stress, and then when you're euphoric, right? But your body can, some drugs, including alcohol, can either make you high or low, right? Depending on when you're usually high, it's usually dilated, right? When you're low, you're constricted. So there are a lot of, antidepressants, a lot of medications, like including drugs, heroin, cocaine that can change people's eyes, right? So why don't you guys come closer? This is important. Can you take your glasses off for me, please? Thank you. Can you look straight at my finger here? All right. So I'm going to use this pen light and keep focusing here, okay? And I'm taking an L shape here, and then I'm looking at both his pupils when I do this. So I can see that his pupils are constricting. Sorry. Okay, equal. So when I say Perla, pupils equal, round, reacting to light. You can write it in that sheet. P-E-R-R-L-A, right? Pupils are equal, round, reacting to light. And then I'm going to ask him to follow this. And you see his eyes are converging. And so will the pupils, right? So you could call this convergence or accommodation. Let's say this person, when I try to do this on him, this one eye is coming closer, this eye is moving this way. It could be a neurodeficit, right? Some type of brain damage or cranial nerve damage. Got it? Nystagmus, drugs, so many reasons can make you. So this is a test you do. I mean, in a normal person, we take it for granted, but if you work in a neuro unit or especially in an IC unit, this will be so important. Got it? So in the ER, if someone comes with, let's say, cerebral hemorrhage, right? So bleeding on one side or stroke, like you said, one pupil will not constrict. Be like fixed and dilated and up and open. Or OD'd, if they OD'd and they passed out and they came to the ER. That's not a good sign, right? Okay, so that's Perla. And then we go down. Is it the upper extremities now? Skin and hair nails, the upper arm. So now you're looking at the upper arm in general. Both his upper arm, those are upper extremities. Do you see any muscle wasting? Do you see any muscle wasting in this case? No, right? Because one could have a big muscle here and then low, right?
What exactly do you look for muscle wasting?
The tone wasting means, okay, if someone had a stroke, or if, I don't know if you know polio, you've seen them, they have wasted, they're hardly any muscle. Or if someone is, had a stroke, they can use this arm as, let's say the right-sided stroke, this will be thinner than the left side.
Okay, so it's more
it's
more comparative as opposed to objective. And I mean, like okay, comparative to him, to the other side.
Good point. Good point. Embrace it. Okay, think about it. When I'm looking at this person, I'm looking at both. I've asked him to do both here, right? So I should verbalize this to you, but I'm looking at both his arms and I'm comparing and I'm seeing if there's any obvious muscle wasting, right? And then I do everything bilaterally because you're doing both together, right? Now I can ask him to move his arm up. Can you fold this arm for me? And then checking his range of motion, right? So initially I did the inspection, right? Now, I'm still asking him to do some movement. Can you bend again up? And then don't let me pull you, okay? This is for strength, see? And if I'm not able to pull him, he's 5 out of 5. You document this as 5 out of 5, right? Bend again, same to the other one. So left and right, upper arm or upper extremities, you say 5 out of 5. Got that? And then you check for pulses. So when I check for pulses, I'm putting these 2 fingers on both and I'm checking if they're equal. Yes, radial pulse is bilaterally equal and I say 2 plus. 2 plus is normal pulse. 2 and then a plus, okay? If it's bounding, what do you mean by bounding? Is it the intensity or the rate? Intensity, right? Boom, 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 boom. Right? When you say it's weak,
Spreading.
weak, it's you can hardly feel it's like, right? When would someone have a bounding pulse versus a weak pulse? Think in terms of fluid intake.
A lot of fluid is bounding pulse. If you have a lot of fluid, is it bounding?
Yes, that's a good point. How
When
about
the pressure is
dehydration?
Yeah.
What will happen to the pulse?
weak.
Got it? Right? So someone with excess fluid, it's just like a tap water. You know, if you have full flush fast water going, you can feel with me. You won't feel a pulse there, but there's more fluids. You can, you know, the vessels are carrying it better, right? And the arteries are like fully. Do you think I felt the artery or the vein here?
Artery.
Artery.
It's the
You
vein.
you can't feel a pulse in the vein, right? So in his case, his radial pulses were 2+, and it is normal. That's normal, right? Not 3+, or it could be 4+ too, right?
When you do the pulse, I mean, you know, and you have to do both bilateral at the same time,
I
right?
want you to do that. Yeah.
Okay.
It's a good practice to check. You can do separately too. I'm comparing when I do both, but it's good practice to do this together.
And how long do you keep it for?
Yeah, just feel it. You're not counting the numbers here,
Okay.
right? So you're just trying to.
So it's not like 30
Yeah.
seconds or 1 minute or anything.
No, no.
Yeah.
And for the heart rate, when you check the vitals, this shows your heart rate too. So when for your vitals, you could use this, but when I come to the heart, I'll show you how to do the epicondylus, right? So let's go at one area at a time. Then you're going to check for capillary refill. Can you put your arms? So this is, you press the nail and then you let go. And you should make sure the blood comes back into the nail bed, right? In with less than 3 seconds. Okay? Why do you check for this?
Peripheral circulation.
Yes, right? You're checking to see if the hemoglobin is carrying the oxygen appropriately to perfuse and oxygenate the solution enough. And if it doesn't refill in 3 seconds, that means there is a deficit. We have to look into more to see what is the
Deficit of hemoglobin and oxygen.
Mostly, you know, the color is usually related to the hemoglobin. Automatically, they go hand in hand, right? If you don't have enough oxygen, you know, you can't tell by this, but what would be the color the patient might have? Yeah, right? Oxygenated blood is reddish. You see? So okay, hemoglobin carries oxygen, they go together, right? Okay, both are needed. If you take this out, this can still go, but be blue. Got it? So this blueness could be related more to the oxygenation. Little tricky concept, but keep in mind cyanosis is usually oxygen related. Blueness, blue babies, right?
Pulmonary embolism.
COPD, you know, you can name a lot, right? Color per se, like erythema, and few more color things we'll talk about. It's more related to the hemoglobin. Anemic patients, right? Pallor, right? It doesn't turn the color to blue, but
Very pale.
yeah. Okay. Don't overthink all this. It should come naturally, you know, like I'm just trying to step in and like tell you a little bit more here, but don't worry too much. So we did the capillary refill, we checked. So we have to check the sensation and the warmth too, right? So can you close your eyes for me and see if can you feel when I touch you here? Can you feel when I touch here? And you see when I do this, I'm also checking the warmth, right? I can do both here, and I think it's warm and warm, right? What if it's cold?
That's another circulation issue.
Could be circulation.
Could be sensory neurons.
Sensor, neuromusculoskeletal, so many things, right? Because neuromuscle go together, circulation and oxygenation go together, right? So warmth could be due to various reasons. So that just those are all abnormal. Let's not go in depth there, but I'm just wanting you to think, okay? So the next part you'll examine would be the abdomen, right? So the abdomen, when you do a very general assessment, you look to see, you know, if there's any raised areas, there's any skin changes, any asymmetry. What if you have like a hernia here, right? Or like you could visibly see pulsations. Those are all not good, right? So if I'm having him here, I'm going to check the abdomen to see if there's any pulsations, any asymmetry, you know, any change in color, or maybe masses or anything, right? After I see that, then I'm going to actually listen to him, and I'm going to listen in 4 quadrants. Okay, I'm going to use a stethoscope. Why do you think I should listen in 4? Why can't I listen in 10?
The vital organs,
Hmm?
the placement of the vital organs.
Yeah, we choose to do that because we think, okay, more, I mean, it's a huge area, right? We divide into 4 quadrants, make it easier, and then listen in 4. We can do more, that's totally fine. But if you can listen to bowel movements in 4 areas, you know, that's normal, right? So I'll do right upper, left lower, right lower, 4. And I would say bowel sounds are active times 4. Okay? And then I would palpate. So I'll use my hand and I'll do gentle and then deep palpation in all the 4 quadrants, okay? When we do a detailed focused assessment, I'll show you more. There's a lot more you have to do for this. But for now, you'll only do like shallow and then deep palp. And ask if they have any pain. Do you have any pain? Right? Check for abdominal distension in the bladder area if there's any bladder distension. They'll hurt, you know, if their bladder is full, right? Alright, so then we move to the lower extremities. And we do exactly this. Oh, I didn't do the heart and lung, sorry. That's important. I can't skip from upper to lower. So the first thing I would do is listen to the heart. So in order to listen to the heart, I'm going to look at as, why don't you all look at your mid-clavicular line? You know your clavicle? You know which is your clavicle? The bone that stretches from your mid-sternal area to the shoulder area, right? And if you make a line from the middle all the way down to your 5th intercostal space. I'll tell you where my 5th intercostal is. So this is my first intercostal space, right? You see this? Between this bone and here, right? And then you have to go down 2, and then 3, and then 4, and then 5. It'll be right below my breast area for all of you, most women, you know, like right here. For men, yeah, go on your left, so it's like right, it's actually right below our nipple on the left side. So that's the area we call it the point of maximal impulse, right? So use a mid-clavicular line and then draw a line from the 5th intercostal space and it's right there. So in his case, so I know this is his clavicle, so mid-clavicular, and then if I go here 1, 2, 3, 4, and then 5. This is where I would feel for his apical pulse. This is really, really important because when you give medications, you have to check for the apical pulse for 1 whole minute. So what you will do is say, I'm listening to the apical pulse for 1 whole minute, okay? And what would be the rate? Normal would be anywhere between 60 to 100, and you say that number, okay? Got that? And then you listen to the lungs. So when you listen to the lungs, I mean, in general, when you look at the chest, you always look for symmetry, you know, color changes, and you know you can verbalize that too. I don't see any. Yeah, look at the skin, especially with lungs. You know, what if someone had a flail chest? You know, one chest is broken. You know, like fracture or something that could be, you know, or pneumothorax, or asymmetry, pigeon chest. There's so many, you know, battle chest. So you look at the shape and the color and all of that, right? Masses, lesions, and then the next step would be to listening, right? You don't do percussion when you do head to toe, okay? And then I'm listening to the lungs. When I do it, where does the lung start? In your body. Which area does your lung start? Where do you listen for your, there? No. There? No. Where does your lung start? Which area?
Right up here.
Yeah, very high up there. It's right below this
The
bone.
clavicle bone.
Clavicle bone. Right below the bone. It's like a, you know, that's the apex. Okay? Where's the apex of the heart?
Bottom, yeah.
The heart's apex is down. The cone point is the apex, right? The heart's cone is down, that's the apex. Lungs apex is up. And it points like 2 sides. Here I can listen to my lung sound. So if I'm going to listen to him, I'll listen in 6 areas, anteriorly and posteriorly, right? So I'm going to listen to his lung sound, start up here all the way. It always has to be touching the skin. In his skin, you know, in our class, I don't want to, you know, like show off everybody here, but go higher up and under the skin, and they go 1, 2, excuse me, 3 and 4, and then on the side 5, and then on the side 6. Same posteriorly, right? Why do you listen to the sides? Do you think you have lungs there too? Where? How far does our lung stretch? Yeah, almost to the lowest rib, right? And it's broader in the bases, right?
Mm-hmm.
And when fluid collects, if people have like pneumonia or CHF, right, or even pleuritis, right? There's fluid below, right? Because water keeps the fluid down. So you make sure you listen to the bases and the back always. Okay, so that's the heart and the lungs. We did the abdomen. Sorry, I kind of like mixed it up. But little changes is okay here and there. Don't jump.
So typically after the head part, you want to go to the, before you go to the extremity?
No, you could do the extremities. Go by that order. It says
Ah.
upper extremities, and then you go to the heart and lungs, and then the abdomen, right? And then the lower extremity, right? And in the lower extremities, you do something, same things as you did for the arms. Okay. The only difference would be you check for two pulses. One would be the pedal and the tibial pulse. Two pulses. Here you did only the radial pulse, right? So you'll do both the pedal and the tibial pulses. I'll show you how to do that, right? So range of motion, can you bend your leg for me, please? And then stretch out. Okay, that's range of motion. For strength, can you push down? Get like a gas pedal, okay, and push down. So this is plantar flexion, right? Pushing down is plantar. Dorsiflexion, push up for me, okay. Bend your knee, push out, okay. Bend your knee, push out, okay. Alright, so his strength is really good, right? 5 out of 5 on both legs. Even in his feet, it was really good. Then check for capillary refill, take the socks off, just like how you did the arms, right? Sensation, can you feel me touch you here? At the same time, you can check for the warmth, right? Pulse is important. I'm going to take your socks off. So watch this, guys. Most of you will have difficulty with this, at least in the previous class. So look at the second toe, the second metatarsal area, right? And then draw a line right below that on this bony area. And usually that's where you can feel for the pedal pulse, right? So I'm trying to feel his pulses. I could feel really good pulses, both, and they're both 2+ and bilateral. Okay, if you don't mind, can they feel your pulse?
Sure.
But after I'm done with it, I'll show you. You know, I'll give you turns. So you're checking for the pulses. You are very clean, don't worry.
No,
Okay.
no.
People get embarrassed, okay? Then you go to the tibial pulse. So this is the the medial malleolus area. Okay, go below that and press down to see if you can feel it. Yes, it sees pulses. Feel his pulses right here. 2+. Okay, only use these fingers because this has a pulse on its own. You know that, right? So bilaterally.
your index and your middle finger.
Yeah, these two, right? You saw me do this, right? Press, and then if you need, you have to press. Some people it's to external sides. Capillary refill, so I'm going to press his finger toes. Yeah, good. That's it. So I press and let go. Within 3 seconds, the blood is back. If the blood doesn't come back, or if it doesn't turn red, what does it mean? I gave you two situations. Blood doesn't come back, what does it mean?
Circulation or oxygenation?
Good. The other part,
Perfusion?
if it's red when I press, it won't become white. It's a trick question.
Color?
Unblanchable. What does it mean? Pressure also. Okay. Let's say this person is lying in bed and there's redness here. Sorry, I'm tickling you, right? So there's redness here, right? And you touch it and see him, he became blanched back, right? If that stays red and there's no whiteness, that means it's setting up a stage for a pressure ulcer. That's stage 1. I'll cover more when you do it, okay? So after I'm done with all that, I did range of motion, strength, sensation, looked at circulation. Did I miss anything? I think I did.
So how would you report that? It's like unblanched. How would you report? I mean, write that down as a
So
the blanch.
in this case, I did capillary refill less than 3 seconds, right? That's all I do, right? However, if I'm doing a focused skin assessment, let's say I'm a wound nurse or you're a nurse taking care of this patient, and you're looking at this heel and you see unblanchable area in the heel, you know, under the skin detailed assessment, focused assessment, then you document. This wouldn't be part of a general assessment, but that'll be.
That's like a spot. I mean, you're gonna actually see the redness. That's what you're testing. Okay.
Yes.
Yeah, 'cause I see them do that at work a lot. So
Yeah. So that's a very first stage of a pressure. So, and then as nurses, what do we do? Maybe elevate it. You know, make sure he gets good nutrition. You make sure he ambulates. Take the pressure off there. I mean, you can't do the 24/7, but watch it frequently. Put some lotion if it's dry. You know. Yeah. Okay. That's a little. I took you out of this thing, but it's always good to link and think and talk. So you connect the dots. All right. So I've done that. So now I've completed my head to toe on this patient. I'm going to ask him, thank him and ask him, do you have any questions for me, Francis? I'm gonna check if he has any tubes. He might have oxygen, he might have IVs running, he might have a Foley, right? Make sure his bed is in the lowest position. Give his colleague to him. Thank him and ask him if he needs anything else before you leave the room, right? And make sure you remove your gloves. So I'm saying, remove your gloves, wash your hands. These are all safety, right? Right, wash your hands. Thank the patient, get all your supplies, go out and you say you're going to document it. Okay, so this is all this what you will do for your final exam. And you'll do great and everybody will get 20. That's the only way, right?